Imagine this, your unpaid hospital bills no longer dragging down your credit score. That was the promise of a Biden-era rule, but now it's gone. A federal judge in Texas has struck it down. That means nearly 15 million Americans will keep seeing their medical debt on their credit reports. Think about it. That's $49 billion in unpaid bills still weighing people down. Judge Sean Jordan said the Consumer Financial Protection Bureau, the CFPB, went too far. He ruled the agency exceeded its authority under the Fair Credit Reporting Act. Basically, the CFPB can't just ban credit bureaus from reporting medical debt if the law says they can include it. It might sound technical, but it's personal. The CFPB's rule was designed to stop lenders from punishing people for unpaid medical bills that often come from accidents or illnesses no one chooses. You don't plan to get sick, but you pay the price on your credit report. Had the rule taken effect, it could have raised credit scores by 20 points on average and led to 22,000 more mortgages approved every year. That's more families buying homes, getting better loan terms, building wealth. But lenders and industry groups fought back hard. They said removing medical debt would make credit reports incomplete and risky. The Consumer Data Industry Association even celebrated the ruling, saying it protects the integrity of the system. They want every debt on record. Republican lawmakers were against the rule too. They claimed it would weaken underwriting and hurt the accuracy of credit scores, especially for lower-income Americans. Meanwhile, consumer advocates say the ruling is a huge setback. They argue medical debt is a terrible predictor of whether someone can repay other loans. Healthcare bills are often full of errors, with patients battling insurance companies for months. And all of that lands squarely on your credit score. Kamala Harris and other Democrats championed the rule, saying it was about fairness because no one chooses to get sick. They wanted to stop a system that penalizes people for accidents and emergencies beyond their control. There's a little bit of relief out there, though. Even before this rule, credit bureaus had already begun changing things. In 2022, Equifax, Experian, and TransUnion announced they'd drop about 70% of medical debt from reports. Paid medical collections no longer appear. Medical debts under $500 are now excluded, and unpaid medical bills don't show up for a year, giving people more time to work things out. Still, the Biden-era rule would have gone much further, and it's dead for now. The judge says only Congress can make such sweeping changes, not the CFPB on its own. Could this be appealed? Technically, yes, but the CFPB's leadership is in limbo. Trump-era appointees have slowed or stopped new rules and investigations. So what can consumers do? Experts say, check your medical bills carefully. Make sure your insurer is paying what they should. And in states like Colorado and New York, look for local laws offering added protections. This case is more than a court fight. It's a reminder of America's messy, often unfair medical billing system, one that can follow you for years. What do you think? Should medical debt be kept off credit reports, or does the system need it to stay fair? Tell us in the comments. And for more crucial updates like this, make sure to subscribe, hit the bell, and stay tuned. Stay aware, stay informed.